Hello everyone. So for today we got a case of this 18-year-old male who presented with these kind of painful muscle cramps after an intense physical activity session, like in this case this intense football practice. So what are we thinking? What can be the cause of these cramps here? So after an intense football practice, what is the most common thing? It's the dehydration, and along with the water, what is lost in the sweat? These are electrolytes, and the major ones are potassium and sodium. Here in this case, as we are seeing the muscle cramps, the one electrolyte which is very essential for the activity of muscles and especially for the repolarization of muscles, it's the potassium. And without the potassium, the muscles can't relax properly. That is why these kind of painful cramps occurs in case of hypokalemia. So we can directly go for a serum electrolyte value in this case and then replenish the potassium levels either via an IV route or an oral route, and can tackle this case. So as I asked, what can be the other differentials in this case? So the other differentials can be hypocalcemia, but in this specific case hypocalcemia is not that relevant because this doesn't occur after an exertional activity. It basically occurs in hospitalized patients, like a patient after thyroidectomy in which parathyroid glands are also injured, or and we are suspecting hypoparathyroidism, then these kind of hypocalcemia can be present. There can be hypomagnesemia, which can very well be in this case, but it usually presents with hypokalemia and other neuromuscular irritative symptoms. The other electrolyte abnormality can be hyponatremia. As we also discussed, the sodium is also lost along with the potassium during the sweating. And but how we rule out that these neuromuscular symptoms in this case are not due to hyponatremia? So what happens in hyponatremia is that the confusion and lethargy occurs before the cramps, and cramps are usually the late presentation in this case. Firstly, the CNS manifestations occur. The other differential can be exertional rhabdomyolysis, which usually presents with a triad of symptoms of muscle pain along with dark urine with the high creatinine kinase levels. So the bottom line is, in the cases of post-exertional muscle cramps without any fatigue, the first electrolyte abnormality you should think about is hypokalemia first. Okay, thank you.